School nurses are certainly among the unsung heroes of this pandemic. In Cleveland City schools, 9 nurses have taken on additional duties to help stop the spread. Channel 3's Grace McKenna has the story.
Every day, Cleveland City school nurses head into battle against COVID-19.
We couldn't have opened our doors without them, and that's just a fact.
Their armor, masks, PPE, and thermometers. They've taken on new duties, screening staff and students for symptoms before they walk in the door. School health coordinator Laura Hudson says nurses also pre-trace students with symptoms and contact trace those who are positive, stopping COVID-19 by identifying it.
Every nurse is probably tracing 10 to 40 kids, depending on the school.
In a role that's difficult enough in a normal year, tracing calls to parents are one of the biggest challenges.
Get a little nervous whenever you're having to make that phone call and send them home for 3, 5, 14 days, whatever it might be at that point.
On average, the district has reported 2 or 3 cases a week. A low-count director of schools, Russell Dyer, attributes to education. He says that's perhaps the hardest mission for nurses, their new jobs as public health professionals.
The nurses have turned from just being a triage, basically, into an education center.
That education is key as they help parents and students navigate the school year and ever-changing guidelines. Dyer says the district's nurses have stayed positive, telling administrators it's a choice they make each and every day to report for duty with battle armor on.
Behind the mask, there are still smiles. Above the mask, there are bright, cheerful eyes.
Reporting in Chattanooga, Grace McKenna, Channel 3 Eyewitness News.
As of last Friday, Cleveland City schools had reported 2 people isolated with COVID-19 and 3 quarantined close contacts.